to the benign cutaneous tumors. First, we will discuss the seborrheic keratosis. Seborrheic, seborrheic keratosis is the most common benign lesion commonly seen in elderly, most common on face and upper trunk. They are stuck on lesions, yellow to brown in color, and is slightly raised. There is also a paraneoplastic phenomenon known as lesser trillate sign, where there is abrupt origin of the seborrheic keratosis in large number, which indicates malignancy, usually the adenocarcinoma of the stomach. Treatment is not necessary, but if there is some cosmetic reason, we can go for surgical excision or save excision, or cryosurgery or curettage, electrodissection or laser ablation. Any of the therapy can be used. Coming to our second topic, that is sebaceous hyperplasia. It occurs in middle to old age person on the forehead, cheek or near the hair follicles. Characteristic points are they are stable in size, yellow in color, and do not ulcerate. There is characteristic umbilicated dome. They can be size of 1 to 4 millimeter. There is no risk at present, but they may transform into the squamous cell cancer. At present, there is no treatment needed, but if there are treatment is sought for cosmetic reason, we can go for save excision or cryotherapy or lasers. We can also try the topical retinoids, which decrease the sebum production and help decrease the condition. Coming to our third topic, which is the dermatofibroma, also known as superficial benign fibrous histiocytoma. It is common in the lower extremities. They are firm, round and oval nodules, more common in females of age group 20 to 50 years. Most of the time they are asymptomatic but can present with tenderness and itching. Treatment is surgical excision or laser ablation. Coming to the fourth topic, pyogenic granuloma. It is a lobular capillary hemangioma which there is rapidly growing size, friable and red violaceous nodules. Most common in head and neck, finger and oral mucosa, most common during pregnancy. Treatment is by surgical management such as curettage and cautery, laser ablation. Topical or oral beta blockers can be given only in children age group. Biopsy has to be done to rule out basal cell cancer and malignant melanoma. Now coming to the cherry angioma, also known as Campbell-De Morgan spots. They are benign vascular lesions, appears with increasing age. Most common site is trunk, arms and legs. They are red to purple, dome-shaped, compressible papule. They blanch with pressure and may bleed with trauma and friction. If symptomatic or for cosmetic reason, we can go for laser ablation or electrodissection. Now coming to acrocordon, also known as skin tabs. They are common pedunculated benign neoplasm, most common in skin fold due to irrigations. They are more common with increasing age, pregnancy and in certain metabolic conditions such as obesity, cardiovascular diseases and diabetes. Treatment is excision. Now coming to keratoacanthoma. They are rapidly growing squamoproliferative tumor. Sometimes they are confused with squamous cell carcinoma. Here a papule is present at start, which rapidly develops crater-like lesion which has a keratotic core and gains size of about 1 to 2 cm over weeks or month. Most common site is face and upper extremities. Sometimes there is slow involution phase. Risk factors are UV exposure, HPV infection, genetic chemical carcinogen, trauma and smoking. Treatment is by excisional biopsy to rule out squamous cell cancer. We take 5 5 mm margin for non-invasive squamous cell carcinoma to achieve 95% resections. More surgery can also be done in cosmetically sensitive areas where we cannot take as much margin freely. Now coming to the pilomatrixoma. Pilomatrixoma are the benign calcifying epithelioma, also known as benign calcifying epithelioma of Malherbe. They are benign, slow-growing adnexal skin tumors arise from the hair follicles matrix cells. Normally the age is less than 20 years. They are rarely malignant. They are solitary dermal and round lesions, most common in arms and torso and legs. Treatment is surgery, but the problem is that there is no capsule. Therefore, care has to be taken for complete excision. 80% of the pilomatrixoma there is beta-catenin mutation. It is also associated with Turner syndrome and Stickler syndrome. Now coming to nevus sebaceous of Jodasan. They are hematoma of the epidermis, hair follicle, sebaceous gland and apocrine gland. Hematomas. Two of the three cases are present at the birth and one of the three cases present at infancy or early childhood. They are solitary, oval or yellow in color and most common site on the scalp. Treatment. There is traditionally we go for early excision because there is potential for the malignant transformation, but this malignant transformation occurs in adulthood. Therefore, we can do monitoring and go for surgery when the child is mature enough for the surgery.